Good afternoon. I'm George Latimer, Westchester County Executive. It is Thursday, December 31st, 2020, last day of the year, and I'm here for our second of our twice-weekly Westchester coronavirus update as we get ready for the beginning of the new year and the long New Year's Day weekend. We have information from the state tracker that is still yet to come for information that would be valid as of today. And we do understand that we're going to see a significant number of positive cases from yesterday into today, but that number is not yet available to us on the state tracker. So we will work off of yesterday's numbers, the numbers that were reported for Wednesday, December 30th. That show that year-to-date, 68,702 positive tests for coronavirus. 60,540 of them had passed the two-week mark, leaving 8,162 active cases. Now, I want to give you the proviso that we've gotten information that there are a significant number of positives that are not yet reporting on the tracker for today. But as of yesterday, the number of 8,162 was just about even with what we were a week before, which was 8,188 active cases. And that's a bit of good news. That would be flat results over the course of the last week. And then if you go back over a two-week period, we were in a bit of a spike in mid-December coming out of the Thanksgiving holidays, and we were at 8,750 2 weeks ago. So yesterday's number of 8,162 is a good comparable after 2 weeks. We've seen a general rise from the end of October through today, and then we had a particular spike that came within a 2-week interval, 3-week interval of Thanksgiving. However, what we may be seeing with the numbers for today, it's been almost a week now since the Christmas holiday, and Christmas, like Thanksgiving, is a family holiday. People meeting in close quarters, members of the family not really subject to some of the external rules and operating potentially with the possibility of spreading the virus in a family setting. So we'll wait and see what the next few days show us. If the preliminary information we have is what we fear it may be, then the 8,162 active cases as of yesterday may jump up 500 cases or so within a day, which is a significant jump, and it may continue over the next few days depending on how much testing goes on. One of the things that we're looking at is the total number of testing, 1,405,557 total tests as of yesterday. Lots of duplicates and triplicates in there now, and many people now will tell stories about how they've been tested 3 and 4 and 5 times to get to those numbers. So when we once started this, we were concerned that everybody got tested at some point in time. The number was comparable to the number of people that live in Westchester County. We're now well over that number by almost 500,000 tests, and that is a factor. As of yesterday, we had 1,661 fatalities to COVID, and those numbers have been significant now, about 4 or 5 deaths per evening. The Tuesday into Wednesday number was 5 deaths to get to the 1,661. Stretched back, that's 37 deaths over the prior week. And if you look back over a 2-week period, that's 80 people having expired over the last 2 weeks as of yesterday. And we don't know what the current numbers are. Hospitalization numbers date back now to Saturday's numbers. Those were the same numbers I reported on Monday. 392 people hospitalized as of last Saturday. And we would expect those numbers would be well over 400 by now, but we do not know. We haven't seen the more recent hospitalization numbers. As I've mentioned before, we now have up and operative a Westchester County coronavirus dashboard, and that dashboard is easily accessible. You don't need to wait for a communicated map in the media or by email or some other fashion. You can go on now and look at that dashboard anytime you'd like, and that dashboard is we're striving to update it in real time so that it shows whatever information it is that you're seeing on the state tracker. It does require lots of manual posting. As I mentioned before in this setting, we get raw data from the state, and then we have people from our information technology department translate that data into a fashion that you can then read, to look at, and comment on. And obviously, we're hoping to be able to break down hospitalizations and death totals. We do not have that information from the state delivered to us. When it is delivered, we will do that. But in the meantime, if we get 500 cases a day every day, that's a lot of work to get to a dashboard that's updated and that you can look at with some additional statistical information that you didn't have in just the maps that were presented previously. There is also a map-only version of the dashboard, which is more friendly to your mobile device. So if you have an iPhone or an Android unit and you use that to check it, the display of it Looks a little bit better if you use this alternate version of it. It's a little more distorted if you try to use the version of the dashboard that you would use when you're sitting on a laptop or desktop computer. All of that is to try to make whatever information we have transparent and available to you, the individuals. We're not hiding anything. There's no purpose to hiding it. We're not here to sugarcoat anything. We're not here to fearmonger. We just want to be able to convey information. And we know that people want to know what's happening in their own community, in their backyard. And somebody said, why? Well, it doesn't really matter why. If a person lives in the community and knows that there may be additional restrictions placed on that community for one reason or another, then they want to know that. I was having a conversation with a friend of mine, I'll leave it at Nick, without last names, just the other evening, and at one of the local places. And we chatted about why do people want to know, what do they want to know, what do they do with the information when they get it. But the bottom line is for Nick and John and Pete and Jane and Betty and every other person out there, what information we have, we will try to put on that dashboard. We'll try to expand the amount of information on the dashboard as we go forward. But again, we have to get that information from another source. We do not get primary reporting data to us as a county government. We're hopeful that it will feel user-friendly and accurate. And so with the numbers that we have today, we are a day short of instant numbers. The numbers will jump up from what we're told, and we'll see how that all plays out. But nonetheless, we're still in the middle of the pandemic. The year may come to an end, but the pandemic has not come to an end. And the presence of a vaccine out in the marketplace doesn't in and of itself stop the spread of the disease. It reduces the potential of it over time as more people are inoculated, but there's still a gap between where we are and where we have to go. Let me mention that the governor has issued 2 executive orders, Executive Order 202.87 and Executive Order 208. You can see those executive orders on the governor's website. Just Google up Governor New York, and you'll be able to look at the executive orders. Most of these are fairly deep governmental extensions of procedures and policies that were put into place over the previous period of time here for COVID. Probably the one that matters most to local elected officials is the extension of the allowance for the open meetings law to be modified to permit virtual meetings of legislative bodies or regulatory bodies. So zoning board, planning board meetings at the local level, town council, village board of trustees, city council meetings, and county board of legislators meetings all are still continued to be allowable on electronic service frameworks, Zoom, WebEx, Google Meet, and a host of other different entities. All of those are still legal to be able to conduct business, to be seen as a formal business meeting so that they don't have to come legislators present with each other, potentially infect and advance the disease. And that will continue to go on. And those are usually 1-month increases, extensions, I should say. And so this will extend it through January 29th. That's part of these executive orders. You're welcome to look at these executive orders, as I said, online. If you have any questions, you certainly can direct them to us, and we'll try to get information. John Noner, our county attorney, who's really a very terrific attorney in general, does a great job for us. He and his team, Justin Naden and others, analyze each of these executive orders to try to determine what do they mean in terms of what we have to do as a county government. And then we share this information with school districts and with municipal governments. So every Monday morning at 8:30, we have a conference call with school superintendents from some number of the 44 school districts in Westchester County. Every Monday afternoon at 3:30, we have a municipal call with local, town, village, and city leaders. We also include the County Board of Legislative members and the state legislative delegation. Our assembly members and senators and staffers for our Congress members are all welcome to be on those calls, where we basically exchange information across the board so that one box knows what the other box is doing to the best of our ability. We send information in between those entities during the course of the week. If something reaches the point where we need to pull everybody together for a conference call, we do that, but we try to make it a formal structure so that every week we can convey some of this information, and these executive orders and the analysis of those executive orders is part of that process. We obviously, as we get ready for New Year, we have a sense of hopefulness going forward, and perhaps the single most hopeful element in our society is the presence now of a number of vaccines that are out there and being administered to try to reduce the spread of the disease, reduce the amount of people who receive the disease. And I'm sure you followed, as I have in the national news, the Pfizer vaccine, which is the first one out, requires low temperature. Those have been identified through various hospitals in Westchester County to vaccinate people who are hospital workers, doctors, nurses, respiratory therapists, anybody who works in a hospital setting who could come in contact with a COVID-positive patient. The second round, which includes the second approved vaccine formula from Moderna has been circulated through the state of New York to a number of chain pharmacies, CVS, Walgreens, and they have been tasked with making sure that the nursing homes of Westchester County and all across the state have sufficient vaccines to vaccinate patients and also staffers who work at those nursing homes, and that most of those phases are underway. Westchester Medical Center has been designated by the state as the regional hub hospital for the 7-county Lower Hudson region. That's Westchester, Dutchess, Orange, Rockland, Putnam, Sullivan, Ulster counties. And they have put together a plan, awaiting or have state approval for that plan. And that is where you're going to see the general distribution of vaccines beyond those initial target groups. It will move to emergency workers, EMS individuals, fire departments, police departments, and other employees deemed essential. And that may include teachers, that may include people who drive our Beeline buses, anybody that helps keep the infrastructure of the society running based on their job responsibilities. The state's prioritization list follows CDC guidelines, and we're working very closely with the New York State Department of Health and the local hospitals to try to do that in an orderly and a safe vaccine program. You can get more information on this by going online to covid19vaccine.health.ny.gov. That's the State Department of Health and the governor's websites, covid19vaccine.health.ny.gov, and you'll find information that they make available as to what the protocol is for vaccines. It's one of the biggest questions around: when am I going to get it? When am I going to be eligible for it? People have asked me that question. I fall into the category of a young senior citizen between the ages of 65 and 75, reasonably healthy, although overweight. And at some point, when my cohort of individuals are eligible to receive the vaccine after higher priorities have been administered, then I intend to take the vaccine. I most likely will do it on camera to show that I have no fear for taking the vaccine. But I don't think, and I believe this very strongly, I don't think public officials should, quote unquote, jump the line. If you're a public official and your cohort, the age and health cohort that you're in, makes you eligible to take the shot, then you take it with the rest of the people that fit that category. We will have some public officials who are further in advanced years, maybe subject to compromised systems that need the vaccine sooner. By all means, they should receive it. The fact that major national figures, the Vice President of the United States, the President-elect of the United States, and the Vice President-elect have received shots, that is to show the importance of how these vaccines will be helpful. And I note that we lost a soon-to-be member of Congress, a Congress member-elect from Louisiana, who died of COVID just a few days ago, to show that this disease does not know stature or status. It can affect anybody at any point in time, and it could be fatal to anybody at any point in time. This Congressman-elect was 41 years old. So we look for a brighter new year, and we hope that the vaccine distribution will work apace. We understand that there were some goals set at the federal level that haven't yet been met. Our job in Westchester County is to try to implement that which comes our way based on the federal and the state policies, and do that as efficiently as we can. With that thought in mind, I want to thank in advance Westchester Medical Center, all the other hospitals of Westchester County for their role of playing in this, those pharmacies that have been tasked with doing this work for the nursing homes, and in due time, the fact that some of our health department personnel will no doubt be involved in vaccine distribution, as they do already for flu vaccine. We appreciate their professionalism and the work that's ahead of them. For those emergency services individuals, EMT agencies, they're receiving now vaccinations, and they're scheduling upcoming vaccination appointments. Each of the agencies are saying that somewhere between 70 and 90% of the emergency technical individuals have either been vaccinated or have appointments scheduled. This is the next cohort after nursing homes. And if there are any out there who want the vaccine, received the first dose within the next week. Both of the two vaccines that are being administered now do involve two separate doses. There's an initial dose, and then depending on the vaccine, either 3 weeks later or 4 weeks later, a second dose. And that second dose is essential in order to have the kind of efficacy that has been established as necessary by the FDA. And so it's not enough to take the first shot, so to speak. You have to come back 3 to 4 weeks later to take the second shot, and that is now underway with our EMT personnel. Obviously, we're on the day before the eve of New Year's Eve. New Year's Eve is a secular holiday of great involvement. The joy of leaving one year and going to the next year is one that we can all be accustomed to. I've, as an adult, seen, if I'm 67, probably about 50 some odd of these New Year's Eves in different parts of your life and different ways that you would celebrate it. This will not be as celebratory as other years have been. The ball dropping in Times Square is a television event. It is not an in-person event. I've never done that. People I know that have done it say it's quite an experience, both negative and positive. It's a once-in-a-lifetime experience. But tonight, when the ball drops and it becomes 2021, it will not be an in-person event. And that would also be true of the ball drop in White Plains, which is our Westchester version of that, and so many other situations. We encourage you, as we did before Christmas and before Thanksgiving, please be careful in the personal connections that you have with other people. I was at a lunch today for the Bronxville Women's Club, socially distanced in a big room with a high ceiling. Doors were open to create air movement. Probably about 10 people where you probably could have accommodated 200 people, spaced out. So it was an event. It was a public event, but it was done in a way that allowed for all of the different protocols that we're advised of. So I don't know how you're going to spend your New Year's Eve, but I would encourage you to use the same discipline that hopefully you showed at Christmas time and that you showed at Thanksgiving as a way to get through this. We do believe we're going to be looking now at a post-Christmas spike and most likely a New Year's spike. No matter how much we talk about these things, people are still free to do the things that they want to do, and there'll be some percentage of people that will celebrate up close and personal. So we know the numbers have a good chance of getting a lot worse in the next few weeks before they start getting better. The promise of the vaccine that's out there is in the process of being fulfilled, but we are nowhere near having universal administering of the vaccine yet. And, I've heard people still talking about herd immunity as if it's some, magical place that we're going to get to and then everything is going to go away and be perfect. At this stage of the game, I'm told a few million doses have been administered of the vaccine, nowhere near enough in a nation of 320 million people. So maintain diligence, maintain vigilance, and do the things that we're supposed to do to the best of our ability. Like anybody else, I forget to always carry the mask with me when I walk out of the car, when I walk out of the office, go back in, get the mask, come back out. Do what you have to do to be safe and to protect the people around you. Also, New Year's Eve has a particular likelihood for people who will drink, perhaps to excess, perhaps within their ability to contain it, and then decide that they're going to drive home from some event. So we encourage you, please, use your common sense. Do not drink and drive. This is for your health, the health of the people that might be riding with you in the car, and the other guy who's coming on the road in the other direction who has no idea that you're driving drunk. And many times when these tragedies occur, the person that dies is the other guy who is perfectly sober when the drunk driver crossed the double yellow line and collided head-on with an innocent individual and cost them their life and the lives of people in the car. We had a terrific automobile accident in Yonkers just within the last week, and it's a terrible, terrible thing. And there's always a tendency for that to happen on nights like tonight, where drinking is part of the social element of the celebration. So Westchester County Police will be out in force tonight on the parkways of Westchester County. Sawmill River Parkway, Cross County Parkway, Hutchison River Parkway, Bronx River Parkway, up on the Taconic, Routes 9A, Central Westchester Parkway, which is the connector from 287 to northbound Route 22, Playland Parkway. They will be out enforcing the drinking laws to curb speeding, to curb aggressive driving, and hopefully to give us as safe as possible a New Year's Eve as possible. Our county police commissioner has seen an increase in aggressive driving, and that isn't as easily trackable. It's an observed behavior that the police will see and can ticket, and they've given out many summonses. They'll give out more tonight, and don't be one of the ones to get it. You don't need the hassle of having to pay a big fine. You don't need the hassle of potentially losing your driver's license, depending on the circumstances, and you certainly don't want to potentially lose control of your car when you're driving too fast, too aggressively. To what end? To arrive at a destination 10 minutes sooner than somebody else? It really isn't worth the trade-off. There will be a stop DWI enforcement presence tonight. We're not going to tell you where the interdiction points will be. That would be giving you information that you shouldn't have. Drive sober, and it doesn't matter if you turn the corner, go down a road, and there's a barrier that you have to pass through and show sobriety. But they will be out there tonight, and we're certainly not going to tolerate people who are unable to operate their vehicle with a very high blood level of alcohol. There's also drug abuse issues that fit into the same category. Our Office of Drug Abuse Prevention and our Stop DWI program, our county police, will all be out there tonight to try to do the very best they can. We also have efforts to make sure that we're secure against any acts of violence, terrorism acts. We don't drop our guard on a holiday. We make sure we redouble the efforts. Operation Safeguard is underway. That's part of what we will do. This is the last calendar day of the year, and we will go into a new calendar year by 12 midnight tonight, which is a little under 10 hours from now. And of course, it's a very symbolic time when the calendar changes. I know I'm of Irish and Italian heritage, and there is an Irish tradition. It's not practiced in all Irish American homes, but I'm told of this from the other side, in which at 12 midnight, you open the door to your hut, your place of residence, and you let the old year out, and you bring the new year in. And if ever we wanted to see an old year go with all of the COVID-related situations, it's a year like this. When you go down the list of people that will not be traveling into 2021 with us, there are very many famous people that we lost this year. Most people know in the world of government and politics, we lost Ruth Bader Ginsburg, we lost John Lewis. And in the world of entertainment, we lost Kenny Rogers, we lost Charlie Daniels. Just the other day, we lost Dawn Wells. You may remember her as Mary Ann on Gilligan's Island. She was the last surviving member of that television show cast. But we've also lost people that we know personally, some through COVID, many through COVID, people who we knew personally, who meant a lot to us, and we lost them in 2020. So we ought to take a moment before the clock strikes 12 to remember those people, to have a certain part of ourselves know that we go on without them, like the wagon train that continues west, even if you have to bury your dead somewhere along the way, but to remember to honor them for the lives they lived, lives well lived, and the people that we know and love, whoever in this year of 2020 lost a spouse, whoever lost a parent. God help you, those who lost a child. That we remember that moment. And we have the festivities as we celebrate a new year with new hope and new optimism. We will have a lot of challenges that will be waiting for us at 12:01. They will look a lot like the challenges we had at 11:59, and that is what our task is. Not just us in government, all of us as human beings. We have our challenges, our family challenges, our personal economic challenges, the challenges we have just in living our lives every day. Our purpose here is to talk about those things that link us as a society through that which government does. There are things in a society that government does not do. We turn to clergy to do certain things. We turn to independent businesses to do certain things in the society. Not everything is about government. But to the extent that government has responsibility, our responsibility continues. We treat sewerage at 11:59 and we treat sewage at 12:01. We police the highways at 11:59 and we police them at 12:01. We have a facility to incarcerate people. We have facilities of all sorts to do things that are necessary and important societal needs. So 2021 will start out looking a lot like 2020. We hope for it to be a better year. We all hope to improve. We all have New Year's resolutions, lose weight, and many other things that are important to us individually and collectively. So this is a good day to take a deep breath. It's a good day to think in terms of how we can make our lives better, how we can change the things about us, myself and each of us, that can improve our lives so that we can be better people and we can have a more fruitful 2021. We don't know where we are going to be a year from tonight. A year ago today, we had no envision there'd be a pandemic. Could not envision it. We could not envision the death of George Floyd and what that would trigger within the society. We couldn't envision exactly how the political year of 2020 was going to play out in the presidential race and the way that has turned out. None of those things could we foresee a year ago today. So today, with whatever optimism we have for the future, we can't foresee where we'll be a year from today. I hope a year from today we'll all be here, that we'll be able to have a dialogue and be able to enjoy each other's company. But that is not guaranteed. Nothing is guaranteed. So let us be, as I always like to say, let us be humble, let us be disciplined, let us recognize that we share a planet with each other. We share the same dreams with each other. We may be in competition over those dreams, but let us remember that we're all here at this moment in time, and we get another chance. When the clock strikes 12, we get another chance. It's another year. It's another chance for you, for me, for all of us. Let's make the best use of it that we can. I'm going to check with Catherine Chaffee, see if we have any questions from the press.
We have one question from Shannon from News 12.
Okay.
She asks, how and when will the elderly get instructions about getting vaccinated?
Well, Shannon, the reality for us is we're waiting to see how publicly the plan for vaccinations for the society at large will be made. What we do know, what I did say, is that here in our backyard, in the 7 counties, which include most of the viewership of Channel 12, News 12, Putnam, Orange counties, Rockland counties, that Westchester Medical Center is going to be the hub for the distribution, and will set up a game plan that the state approves, and then the state will authorize. Once that game plan is in place, then Westchester Medical Center will determine how will they use the other hospitals in this region. Will they use the county health departments of Westchester, Rockland, and the other counties to help disseminate that? And then within that, we'll see exactly what kind of a time frame, how many doses we expect to get, and then that priority will come. We do know that seniors will come before the general population. If you are 65 and older, you are most likely going to get it before anybody who's under 65, unless the person under 65 has a compromised immune system or has some health reason that prioritizes them beyond their age. But if you're healthy under the age of 65, you will wait a little longer. If you are healthy over the age of 65, it will come sooner. But how soon that is, we won't know until we see what kind of a game plan is laid out. And we'll have to mesh with the federal government's allocation of vaccine by state. You've heard a little bit about different states having different target numbers, and some haven't reached that number. They haven't got enough product. All of that has to be sorted out at the federal level, working through the state, and then those of us in the county will know. And of course, to Shannon and her colleagues at News 12, who cover this story so well, as do the other members of the press, whatever we know, we will announce it as soon as we know it. Happy to share it with you transparently. Any other questions? If there are anybody from the press that has any questions that we can answer, please reach out to Catherine Chaffee. We'll do our best to try to answer it if you're, filing a print story or what have you. For those of you who are watching, either seeing this in real time or may watch this later on tape, I want to wish you a very happy New Year, a healthy New Year. May it be the New Year that you hope for, that we all hope for. I'm George Latimer, Westchester County Executive. Have a good day. Stay safe tonight. We'll see you next year.